Hello, Dr. Russ here. Today Renae has agreed to let us work on her jaw. And she has a chronic jaw problem which came on after a dental procedure some years ago now. Yeah. So we're going to start with her facing down so we can just kind of gently work through the upper back, shoulders, and middle back just to help get her relaxed and warmed up. Don't necessarily want to dive right into the jaw work. So the intention of the jaw work is to get into the masseter, temporalis, pterygoid muscles, mobilize the TMJ, both sides. And in order to do that, we're going to have to do a little bit of work inside the mouth. And of course, we'll wear gloves to do that. But I wanted to show you how that's done. Nice deep breath here, Renae. Good. And feeling a little stuckness right here in the rhomboid. Good. Can you take a deep breath into these right ribs here, Renae? Good. Rib and scapular mobility is so important for any head and neck issue because the ribs and the shoulder blades are the foundation for the head and the neck. So we need those to be mobile, strong, and stable. So here, just working the fascia on both sides, over the serratus anterior, right here, and all these intercostals here. So important. Good mobility through there. One more nice deep breath. How's my pressure?
Very good.
It's good. Breathing out. Good. It's the right jaw that's more problematic for you? Mm-hmm. Okay. Good. So my favorite hold on the shoulder, get one hand underneath the front of the deltoid, the other hand on the scapula, and just mobilize that. And then we can mobilize the ball and socket here. As we come into her neck, it's always a little more sensitive. The structures are much smaller, so we want to slow down and lighten up. Definitely always a proponent of being gentle with people's necks. Nice. Good breathing. Let's do that on the left side now. Just a little bit sticky through this upper trap right here. Just work some movement into this muscle, the fascia, its attachment on the scapula right here. Circulation, mobility, that's always our goal. Nice, okay. Nice and slow, let's get you turned over, okay?
Okay.
Let's feel the head and the jaw. Can you give me a little bit of a gentle clench? Gentle clench, good. And then relax. So I have the angle of her jaw right here, and the body of the mandible here. Here we're on her zygomatic arch. So her TMJ is right there. And I want you to open real slow. Yeah, all the way. So I can feel the condyle of her mandible sliding forward and bulging out a little bit. That's not bad. Come close again. It's a little bit tight. Here I feel some tension in the masseter, and we're going to address that from the inside. Can you go again? Open? Yeah. So the tension on the masseter is come closed, inhibiting the forward glide of that condyle in the TM joint. And so that's something we're going to want to try to gently, incrementally improve. It's not comfortable to make big changes in a person's jaw joint all of a sudden. And so here I am on the tendon of the temporalis muscle, such an important muscle that attaches to the conoid process of the mandible and wraps about like this, comes behind the ear and kind of takes up most of the side of the head. And it's a jaw clencher and it's a jaw puller backer, retruder. And it holds a lot of tension when people are tense in their face and jaw. Usually this muscle gets short and tight. And that can cause a lot of headaches as well as jaw problems. Tension headaches, pressure headaches. Imagine both of these muscles, one on each side, sort of squeezing your head like a vice. And so I'm giving it a bit of a stretch here. I've grabbed the skin and I'm pulling it superiorly. And with my other hand, I'm adding a little bit of traction on her neck. Just like that. So this is gentle. I'm not digging. I'm just more kind of grabbing and gently tractioning. Nothing sudden. And again, no digging. There's not a lot of fascia between the skin and the cranium. And so it's really like a 1/16 of an inch, a tiny little bit of depth. But it can really pay big dividends to take a little time to work out this muscle and the fascia. And when I do, I also like to work on the frontal fascia, the frontalis muscle, and just gently getting some tension out of those eyebrow muscles, the eyebrow raisers and scrunchers. A lot of muscles of facial expression hold a lot of tension that we don't even feel, we don't even know about. So is that causing her jaw problem? No. Is it helping? Definitely not. So while we're here, let's work it out. Okay, we're going to do the other side too. Not much pressure, no hurry. On this side, I feel like I'm going to give it a bit of a stretch. So I've got my two thumbs, one on her masseter and one on her temporalis, and I'm just kind of gently separating my thumbs to give it a little bit of traction. Think of it like lifting the temporalis up toward the crown of the head. A little bit of cross-fiber massage. Not aggressive, just gentle. And it just let go a nice little bit right there, which was good. Did you feel that?
I felt something.
You felt something change? Okay. Now I'm keyed into this upper 2 or 3 inches of her SCM on both sides where it attaches to the mastoid. It really influences the position of the head, which really influences the position of the jaw. So we're going to check in with this muscle here. And not bad. And the scalene and the levator a little bit tight. Right through here. So again, it's kind of the same idea. A gentle pull, a little bit of a very local stretch. With my left hand, I'm pulling her head gently toward me and turning her face toward the window, getting a little bit of a stretch on that scalene and that levator scapula. And finding this attachment trigger point on her occiput right here. Feels like a superficial paraspinal muscle, maybe like a splenius. It's too far lateral to be the upper trap, and it's too far posterior to be the SCM. So we'll call it a neck extensor. And we're not going to grind on it. We're just going to gently kind of iron it back onto the bone. Following that fascia up the occiput. More mobilization, and here it's connecting to the back of the temporalis muscle. So that line of tension coming up here from the levator through the cervical extensor across the occipital fascia into the temporalis and heading right to the jaw joint. It's important. Not only is it good to work out this tension and try to release these trigger points, but it's really informative to the patient's brain to give them some sensation of these connections so that even on a subconscious postural level, they can understand how these things are all coming together, even if we're not talking about it while we do it. So I'm going to put on a glove. Renae, you ready? Okay, here comes the intraoral work, and we're going to be gentle and always take our time. Okay, so Renae, open your mouth, and I'm not worried about getting bitten because I've got my finger kind of tractioning her cheek out a little bit. Now your teeth come really gently together. Don't bite. So I'm outside of her teeth. I'm not worried about getting bitten. I've got my fingertip in the corner, the front of the body of her mandible where it meets the zygomatic arch. And I want you to open wide, please, and close. And as she does that, a couple more nice and slow, I'm feeling for the forward glide of that condyle of the mandible. And I want to encourage it and induce ease of that movement. So I've got my finger hooked on the inside of the masseter muscle here, right in front of that mandibular body. And as she opens, I'm going to pull and stretch on that masseter really gently. One more time. Okay, come from all the way closed, teeth together. Good. And open all the way. Nice. So that can be a really intense sensation for patients. We want to be gentle. So let your teeth rest together really gently. And now with her just at rest and her teeth really gently together, I'm going to take my finger along the underside of the zygomatic arch and I'm really gently going to sweep. And we'll find tension and trigger points here. This is not aggressive. You can see I'm going really slow. It's taking me about 10 seconds to move an inch. I'm not digging, I'm being gentle, but also being really direct. I've got my finger right on the muscle. I've got my thumb on the muscle from the outside, and I'm giving it a stretch. And right there, I feel the stretch is coming all the way up into her temporal bone. She feels that too, and that's a good one. So can you open real slow while we do this? Good, and a nice fascial release happens right there. Really well done. Bring your teeth together. So I just released my pressure to give her a little bit of a break, and we're going to feel it again, and that was good. I want to do that one more time, okay? So let me get my grip. So I'm really gently, not just yet, Renae, really gently pinching that masseter, giving it an inferior traction. I feel it pulling to about here. And as she opens, I'm going to follow her. Open, go ahead and open nice and slow. And we get a big fascial stretch on that masseter. And then you relax and your teeth come together. That's about as much as I want to do on any one side on any given visit. And we're going to do the left side as well. You ready? Good. That's intense.
No, it released something.
Yeah, it feels good. Good, good. Ready for the left side? You take as long as you need. You good?
Good.
Okay. So again, open. I'm going to hook her cheek, get outside of her teeth, and you nice and gently bring your teeth together. Portland. Okay. Nice and slow. Open wide. And this side definitely moves better. So there's not as much work to do on this side, but we're going to go through the same general process. Go ahead and bring your teeth together. So I've got my finger right up against the underside of her zygomatic bone, and I'm going to feel for tension and trigger points here. And we find a little tiny little bit right there, about halfway along the zygomatic arch. And here what I'm feeling is I get a little pinch on it, and I'm going to stretch it out laterally toward me and a little bit inferior. And that's just a matter of practice to feel which way that muscle wants to be stretched. And it's a little bit of a matter of engaging it, listening, giving a little bit of a tug, and seeing where the line of tension really is. And here in the mouth, these tiny muscles and really sensitive stuff, takes a lot of practice to get here, but okay. Open nice and wide, nice and slow. Good. So I'm feeling a pretty taut band in the masseter, on the posterior edge of the masseter, and I've got it in my fingers right here. Thumb on the outside. I'm pointer finger on the inside and open real wide. And we're going to give that a stretch just like we did the other side. Beautifully done. Very nice. Good. And then relax. And so my fingers were sliding as she opened. It was sliding a little slower than she was opening, so I was giving a stretch to the fascia and mobilizing the fascia as she opened. So one more time, Renae, open wide. Really well done. Good. 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 And relax. So we have a little more time in the session. I like to work around the clavicle anytime there's upper body work to be done, especially after jaw work. These subclavian tissues have a lot to do with lymphatic drainage of the neck. All the head and neck need to drain right through here, through the lymphatic system. So to any extent that I can mobilize that and facilitate that, I want to. Nice deep breath here. Yeah. And as she lifts her ribs with the breath into my fingers, I'm going to maintain my pressure so that her ribs have something to sort of push against. Go one more time. Good. And as usual, you find some tension here in these upper pecs and underneath the upper pecs and the intercostal muscles and the intercostal fascia. But as I give her shoulders a little bit of a rock, you can see her head just responding really easily and smoothly. That's a really good sign that things are pretty relaxed in there. One more nice deep breath. Beautiful. Giving some counter pressure to the breath through my fingertips, and then following the out breath, really depressing those shoulders and the ribs. Thank you, Renae.
Oh, thank you.
You're welcome.